Okay, so when I hear the word pelvis, I often think of the movie Grease when she says, keep that pelvis far from me. Or maybe a yoga class where I've heard about the pelvic floor. But there's a lot more to know about your pelvic health. And that's why I've invited my guest today. Her name is Susan Winograd. Susan is founder of Pelvic Core Rehab and Wellness in Boca Raton, Florida. She was previously a pediatric physical therapist and concierge outpatient physical therapy company. Owner of, right? So owner operator of, and but her focus now at Pelvic Core Rehab and Wellness is more holistic. And you know me, I love that word on Holistic Health Heroes. And so she's working with people on all different things from digestive issues to hormone imbalance, fatigue, inflammation, prediabetes, autoimmune, and she has a lot more to say. So I know there's probably more that I could share there about your background and experience, Susan, but for now, I'll just say welcome.
Thank you so much. And Grease is my all-time favorite movie. Go Grease Lightning. I feel like I grew up on that movie. It brings back the best memories. But yeah, their definition of pelvis was a little limited. I think we can expand on it.
Right. Absolutely. And me too. I love that movie as I'm sure so many did. So yeah, so when I first met you and you said that you're an expert in this area, you're pelvic health, pelvic core and things like that. I found myself going, I really don't know much about that at all. Like, maybe to introduce that concept, where do you start when you meet people and they just kind of have this sort of head scratching moment about it all?
So, it's really, I find it difficult to put into a sentence or two because it really is whole body. But one thing that I like to impress on everybody is that we all have pelvises and we all have pelvic floors, both men and women alike. And what I really like people to know is that pelvic health um, generally encompasses bowel, bladder, and sexual dysfunction. I'm sure we'll get into how much broader we need to look if we're going to look at holistic pelvic health. But anybody that has a pelvis and a pelvic floor has to deal with bowel, bladder, and sexual function. So anything that includes that is how I like people to think of pelvic health. And it really can be men and women of all ages in any season in life. When a lot of people think of pelvic health, they think of older people,
Right.
incontinent, but actually in Pelvicore Rehab and Wellness, we actually have a young demographic. So people of any age can have bowel, bladder, and sexual dysfunction. And one key takeaway that I always want everybody to know is that just because something is common is not normal. And if
Very
you
good.
know something is not normal in your body, even though it's common, nip it in the bud and go to a professional who can help you because there is help. Did I answer
Absolutely.
your question,
Yeah.
Carrie?
Yeah, absolutely. No, I think that's so important that you highlighted the different age groups. This is not an older person's problem.
Mhm.
Could happen very young, really.
Yeah.
And, what is in the body the role of like the pelvic floor?
Yeah, so that's a great question. So if we're going to just go into the functions of the pelvic floor, let's just backtrack for a minute or back up for a minute and just kind of get like a little bit of a broader visual of what the pelvic floor looks like. So the pelvic floor muscles are a group of muscles that go from the pubic bone all the way back to the tailbone and from one side of the hip to the other. So Carrie, if I were looking at your body from the head down, your pelvic floor muscles would look like a cereal bowl, a dome shape, a hammock shaped group of muscles. And they are really way more intricate than people think. So we have 3 layers of pelvic floor muscles. Each layer has at least 3 muscles in it, and then we have side to side. So, when we're thinking of a pelvic floor exam, you can now begin to understand that it's really a lot more than just Kegels. It's actually pretty intricate. And the pelvic floor muscles we call them the 5 S's in terms of function. It has a sphincteric component, so like a closure mechanism. So we're not peeing and pooping all over the floor. right?
God forbid.
In layman's terms, there is a sexual component for sexual appreciation. There is a support component. So, though that your pelvic organs, if you're a woman, it would be the bladder, the uterus, the lower rectum. If you were a man, it would be the bladder, the prostate, the lower rectum, lay right on top of that third layer of pelvic floor. So, the pelvic floor muscles support your pelvic organs. There is a stability component because my absolutely favorite thing to teach people about their pelvic floor is that it is part of their deep core system. You cannot have good support in your body if your pelvic floor is not functioning optimally. And last but not least, it acts like a sump pump. It has a lymphatic component, just like every other skeletal muscle in the body. As it pumps, as it contracts, it helps to pump fluid back into our circulation. So a little bit of a buzzword now is pelvic congestion, right?
Oh, I haven't heard that one.
So that's kind of a term that's popping up a little more commonly now, even though we've been hearing it for years. And that's multifactorial. But when we hear that, we want to think about, are those muscles pumping fluid back into the lymphatic system? So
Mm.
you can really begin to appreciate that this is a really, really important group of muscles for your overall holistic health.
Absolutely. And it's so interesting to me to know and recognize and then share the word about how interconnected everything is, because nowadays where we are in the medical system is that everything's so separated, and that's not serving us. So we have to bring it all back together. And I think that you do a great job in doing that. And another thing I always like to ask my guests is, for lack of a better word, like your why story. And I know a little bit about how you got into this, and I find it fascinating because it's kind of maybe surprising, again. So maybe you could share a little bit about how did you end up in this area of expertise?
Sure. Yeah. So I'm going to make a very long story pretty short. So
Okay.
I think anybody that goes into pelvic health kind of has their own story, right? So I'm blessed to have 4 children, and now am even more blessed to have 3 children-in-laws who I get all the benefit from, but didn't have to do all the work for. But I did have 4 very, very difficult pregnancies. And at that time, I was not a pelvic floor therapist. So when I give my workshop, I go into detail about what those really difficult pregnancies looked like, and my lack of support and answers to my questions, and the fact that I was repeatedly told that pain during pregnancy is normal. You'll be fine. If you need help after you give birth, we'll find it then. And I was pretty young when I had my kids, so I knew that wasn't normal, but I just did not know how to navigate pelvic health at that point. Fast forward about 20 years, in my other business, Home Advantage Rehab, I started getting a lot of referrals for falls. And I think in the back of my mind, pelvic health was always an interest of mine because of my personal experience. So in treating all of these balance clients in their homes, I was finding that these clients were not falling because of balance issues. They were falling because they were running to the bathroom and couldn't make it in time. And I started doing bowel and bladder retraining in the context of that business. And then I had the good fortune to connect with a physician who really just called me one day and said, Susan, I've got all of these pelvic pain clients and I don't know what to do with them. Will you learn? And I said yes. And I completely reinvented myself within a year. That was 10 years ago. I shut down and I opened Pelvicore Rehab and Wellness. And what I always say, Carrie, is once I took that very first pelvic health and wellness course, they gave me the Kool-Aid and I drank it. And I have not stopped because it is the most fascinating field in the world. So,
Wow.
there were segments to my story, but there was a very personal component. And there was definitely a component of me realizing that this is a very underserved population and I could make a huge difference in people's lives.
I love that story because, it's, you don't, I was surprised. The surprising part I was referring to is like how you learned that people were falling on their way to the bathroom, because you hear about that can be the real downfall for people who are aging. When they fall and they have the hip break, and then they're like on their way out basically. And it's so sad and so scary. And if they could know this information, to know that it has to do with running to the bathroom in the night, it's like that was like an aha moment for me.
Yeah.
So wow. And so
You
what
know,
is
I
bowel
wouldn't
and
even
bladder?
blame the physicians for that. I was finding that even the clients were not putting two and two together. So, when I kind of turned on that light bulb for them, they were like, oh my goodness, you're right.
Yeah.
So just a little bit of education I found went such a long way. I'm sorry, you were going to say
Yeah.
something.
I was just, a follow-up question is, what is bowel and bladder retraining?
Yeah, that's a great question. So, again, that is so multifactorial. When we talk about, let's say, bladder, um, when we talk about retraining, we can talk about urinary urgency, frequency, leaking, dribbling, inability to void, hesitancy. And there are really two parts to that. There is a muscular component. So, there's a huge misconception that you are going to leak if you have a weak pelvic floor. And that could be true, but you are going to get very similar symptoms if you have too much tension in your pelvic floor. So we have to determine first, is there too much tension or is there too much weakness? And then help the person accordingly. But there's also a neuromuscular component.
Mm.
What I think is fascinating is that our bladder is not under our voluntary control. Our bladder is smooth muscle, so urination is a reflex in our body called the micturition reflex, and that reflex can get wonky for whatever reason. Pregnancy, childbirth, an infection, an illness, whatever the reason, it can get wonky and we need to retrain that connection.
Mm.
In terms of bowel movements, there could be constipation, fecal incontinence, inability to hold back wind. So there's so many things I can go on and on. But again, there's a muscular component, there's a neuromuscular component, and there's a mechanical component. You'd be surprised. There is a right way to pee and poop. And sometimes if we just teach people how to optimize their mechanics, their life can change.
Right. Makes me think of like the little stool that you're supposed to use because
Potty potty.
right?
There's
Right.
that's
Like, yeah,
part of it. Yeah. Mhm.
potty potty is called, right? Like, okay, yeah. So you're meant to be like, I think, caveman style, like that you're squatting down to go to the bathroom.
Absolutely. But I think this is important to insert here, Carrie,
Yeah.
that when we talk about bowel and bladder retraining, and this is how my practice really evolved, we have to start talking about gut health. And we need to start talking about nutrition and
Mm.
how is the person hydrating and what are they eating, and what's the diversity in their diet. Again, it's so multifactorial, and my practice has really led me down this beautiful path of holistic, whole body healing because we really truly can't just look at the bowel and the bladder.
Amen. Yeah, I agree 100% because it is connected. Because right then, right, as you can see, this conversation where it's headed, it's like, okay, now we're going to talk about how are you using the bathroom. But then again, like if you're having all this constipation, what are you eating?
Right.
Are you drinking enough water? Are you drinking too much water? Like, where are you with all the habits that lead to then your digestion and then your elimination?
Yeah.
So, yeah, good
Yeah.
point.
Can I share a fascinating story?
Please, please. I love stories.
Yeah. So I had a sweet client who started leaking pretty spontaneously, and of course it's very alarming when you're
And
completely
embarrassing.
and embarrassing. And she lost about 100 pounds and really
Oh,
changed her diet, but in replacing some of her less desirably healthy foods, she replaced it with seltzer because she was trying to get that flavor bubbliness, but she did not know that carbonation could possibly be a bladder irritant.
Mm.
In bowel and bladder retraining, we go through bladder irritants, some foods that may irritate the lining of your bladder and cause urgency, frequency, and leaking. And we talked about that her first visit, and I never saw her again. Thank God, because all she needed to do was eliminate the seltzer. That was that lifestyle modification for her. That was that golden nugget. So we
Wow.
really need to look at big picture. What are people eating? How are they moving? How's their pelvic floor health? So it's truly got to be whole body and
Amen.
multi-system.
So when you say you never saw her again, in a good way, because that fixed her problem.
Yeah, she called me and she's like, "You're never going to believe this. I eliminated the 2 liters of seltzers a day I was drinking and I never leaked again." And I said, "That's awesome. It's awesome." Because she did have a healthy pelvic floor. Her mechanics were good. So we have to start being detectives and putting pieces of the puzzle together and help these people figure out. And isn't it nice when it's not something super complicated?
Absolutely. And just asking questions is so valuable. I mean, that's my big thing with people, not even just with a medical situation. Of course, that's very critical to ask the right questions, but even in daily life, the more curious we are about each other, I think
Yeah,
the better connections we have and just the better conversations we can have, right?
absolutely. Absolutely. I love that.
So to kind of continue to bust this myth about pelvic floor being a concern for when you get older, are there sort of like some overarching general tips that we should know about our pelvic health when we're in our 30s, when we're in our 40s, when we're in our 50s?
Yeah. So I think I'll talk about women first, okay? Because that's an easy one. I think that every single woman who is, going into a pregnancy, is pregnant after birth, should please be proactive about your pelvic health. And I really say that so passionately, Kerry, because what I see time and time again is that women, and it is never too late. So if you feel like you're behind the 8 ball, you're not. There's always help, but of course, nipping things in the bud is always better. But what I see time and time again is women coming in perimenopause and menopause who were not as proactive as they should have been in their younger years. Their body has lost a bit of the resilience. Their pelvic floor is not as healthy as it should have been. And then things start coming up. Whereas I know that if they would have taken care of that after birth,
Mm,
and I'm talking about a vaginal birth, a C-section birth, they would have been in such good shape. So that is definitely something I like to beseech all women is you deserve that.
yeah.
The other thing is women in that next season of life, which is perimenopause and menopause, again, we're really, really dealing with a huge shift physiologically, hormonally, nervous system wise. And I absolutely think that a little bit of education and being proactive can really help women feel vibrant and energetic and, sexy in any season in life. So that's where I would say for women. And also we treat lots of young adults who, have recurring UTIs, have yeast infections. If you feel something, say something. We can
Mm,
help you. In terms of men have the same issues as women, obviously not after birth, but women can develop weakness. They can develop tension. They can have pain with sex before ejaculation, after ejaculation. So be proactive. The quicker you nip something in the bud, um, the quicker it can resolve. I always say the longer you let something go on, the more layers it develops. And then we have to start peeling back the layers. But I really think pelvic health is something that we should be mindful about and be proactive about throughout life. And when I say that, I mean total body. I mean being mindful of your nutrition. You cannot have good pelvic health without good gut health. You
mm.
cannot heal something going on in your pelvic floor if your nervous system is wound up and is in fight or flight. So, what I would say, an overarching theme is that your body communicates with you. It gives you messages, those check engine lights that come on that alert you that something's going on in your body, listen to them because your body is giving you a gentle nudge to say, come on, we got to do something about this.
Yeah, yeah, you bring up a good point there. And I have just did an episode not too long ago about anxiety because I feel like anxiety is on the rise. I mean, I think statistically the data proves that as well. But what does worry and anxiety have to do with pelvic health?
Yeah, that is such a great question. So I will say, during the pandemic, we never shut down during the pandemic. We were busier than ever during the pandemic. Why? Because people had so much anxiety and worry. In order to heal any part of your body, especially your pelvis, we need to approach it using a biopsychosocial approach, which means
Biopsychosocial. Okay.
biopsychosocial. So bio is your body, musculoskeletal. Psycho is your nervous system. And social, we all know how important social connection and interaction is. But because we have found that so important and truly, Kerry, I believe and I hope even more that the paradigm of pelvic health is changing to a biopsychosocial approach. We now, as clients come into our practice, ask them about depression, anxiety, catastrophization, central sensitization, self efficacy. Because if your nervous system is wound up, if your nervous system is worried about a certain part of your body, where is your attention constantly going to be drawn? To that part of your body, and your brain is going to do what it does best. It's going to protect that part of the body and you can really develop hypervigilance. You can develop hypersensitivity, which means that it is not in your head. You will actually feel pain to a more acute degree than somebody else may. And if you don't take care of it, you may develop what's called allodynia, which means pain to a touch that somebody else would not find painful at all. So just
Wow.
to give you an example, and that area may spread over time if you're not addressing it properly. So I had a patient once who was sitting right next to me, and she had pretty significant persistent pelvic pain, and I put my hand on her leg to reassure her about something, and she said, "Oh my God, that hurts." And it was such a light touch. She had so much allodynia and hypersensitivity because her nervous system was on such high alert.
Well, that's a term I've not heard before, but it makes me think of sympathetic dominance. Is that the
That
same thing?
is the same thing. Yes.
Okay.
So
Wow.
sympathetic dominance, fight or flight, a wound up nervous system. Um, it's all the same thing. We need that sympathetic nervous system throughout the day. But what we really need is to be able to be resilient, for our nervous system to be able to go on alert when it needs to alert us of something, but then come back to baseline afterwards. People that are in pain stay in that sympathetic part of their nervous system all the time. It's like driving with your foot all the way down on the gas pedal all the time. It's really not sustainable. It's exhausting, and you're going to run out of gas soon. It's pretty
Yeah.
debilitating.
Oh, so terrible. Like so would you say then that in that example, her sympathetic dominance, her allodynia, like that really did create pain that she felt for real?
It is for real. We actually can develop nociceptive receptors, which is pain receptors that become stronger and stronger over time. So it really breaks my heart when people go to the doctor and the doctor says, "It's all in your head. Have a glass
Yes.
of wine." It's not all in your head. Your body is actually feeling that manifestation of a wound up nervous system.
Yes.
So when people say they're in pain, we have to believe them.
Right, right. Oh, I think that's so very key and so not known really by the masses, general population. That's what all this, self-care, some people think it's woo-woo, deep breathing, whatever, yoga, like this world of calming the nervous system down is really serious stuff in the sense that it can actually really help and change your health around. It's not that it's frou-frou fluffy, it's real.
It is so real. And one thing that I would love to add to that, Carrie, is, thank goodness we live in at a time when there is more awareness on self-care and people are working harder on self-care. But particularly when it comes to healing pelvic pain, we really have to cultivate an individualized self-care system for them that is going to complement their physical healing. So that's why when someone comes to us, we give them questionnaires on depression, anxiety, stress, worry, because that will determine what kind of self care program we give them. And I think, a lot of therapists think they're helping people calm their nervous system with breathing techniques and other things, but are we really throwing darts in the dark? I think that has to be a highly individualized part of their plan of care.
Interesting. Yeah. I mean, because I also picking up from what you're saying there is that we don't want to overwhelm people with a long list of to-dos on self-care when they're already wound up tighter than you can imagine.
Absolutely. And we certainly don't want to give them strategies that are not going to be the most effective for them.
Right, right, right. So, there's a lot of different things that you talked about with the pelvic floor, but when it comes to frequent urination,
Mhm.
I often think of frequent urination, something like that, to be related to something like candida.
Mhm.
But physiologically, like from a physical therapist type of, the bio part,
Mhm.
what else is there that people need to know about when it comes to something like that?
Yeah, that's a great. I love that question actually. And yeah, something like candida can cause frequent urination because it's a bacteria. It will irritate the lining of the bladder. Your bladder will want to get rid of it. But there are so many reasons why people may have frequent urination without any kind of bacterial infection. One of them being a wound up nervous system, Carrie.
Okay.
Frequent urinary urgency and frequency is an autonomically mediated dysfunction, meaning when our nervous system is wound up, we are going to get urinary urgency and frequency. Why? Where does bowel and bladder live in our nervous system? In the parasympathetic part of our nervous system, in the rest, digest, repair part of our nervous system. So that's one component of it. The other major component I find is when people allow their bladders to be the boss of them instead of them being the boss of their bladder. So our bladder has a certain capacity. Most bladders can hold about 2 cups of urine. What a lot of women and men do is they will pee just in case. I'm going to pee just in case because I'm going on uh holistic health heroes podcast. I'm going to go pee just in case because I'm about to treat a patient. I'm going to go pee just in case because I'm going to the supermarket. And when you do that consistently, what you're doing is you are training your bladder to give you that urge sensation at a lower volume.
Oh,
So
interesting.
yes. So in a situation like that, we have to make sure that we're retraining the bladder to full capacity. We don't want to go just in case. We want to go when we have a strong urge.
Oh,
Um,
so 2 cups is a lot of liquid.
yeah, about 6 to 800 ml. Different for different people, but it's a lot of fluid. So, it's about 12 Mississippis if you're going to the bathroom and counting. So, I mean, typically people know when they're going to the bathroom, if they're just peeing a little bit for a couple of seconds, they know that they went just in case, right?
Yes.
I
I mean,
mean,
I would say I'm a just in case peer for sure.
a lot of us grew up like that, right? Our moms would say, "We're going out, just go to the bathroom before we go just in case." right? So I think there has to be a shift in how we're treating our children to honor their bodies when they have an urge, and maybe tell them, you know what, if you don't have to go, don't go. Anywhere we go, there's going to be a bathroom there,
Mhm. What
right?
about this idea of, this, oh, don't hold it. It's so bad for you. Don't hold it. It's so bad for you.
Great point. So that is great. So just like we have don't pee just in case, we also have don't have a camel bladder. So again, our entire lining of the bladder is lined with receptors that sense stretch. So we want those receptors to be engaged when the bladder is full, to say, Susan, your bladder's full, you got to go to the bathroom. But if you hold it when those receptors are fully engaged for a prolonged period of time, you may desensitize those receptors. So, for example, we see this a lot in pharmacists, teachers, mail carriers, shift workers, people who have very long stretches of work who don't want to go to the bathroom. I recently had a mail carrier and a pharmacist who had 12-hour shifts, and they didn't want to go to the bathroom while they had their shift going.
Oh, 12 hours, no
Yeah,
bathroom.
no bathroom for 12 hours. And they developed some leaking because they decreased that sensitivity to the urge. So you really want to honor a strong urge. That's the bottom line. Typically, the way urges work is that when your bladder is about a third of the way full, you get that first signal in your brain that says, Carrie, your bladder's filling. You may have to go to the bathroom in an hour. And you could typically forget about that first inkling for about an hour. And then an hour or, give or take a little bit later, you get that strong urge to say, okay, you need to go find a bathroom now so you can go. And you really want to honor that urge. And remember, it's all a reflex. So you really want to make sure that reflex doesn't get wonky. It's delicate communication between the brain and the bladder. And then, of course, the pelvic floor comes in because it's got to be strong enough to overcome the pressure of a full bladder and then completely relax when we're ready to let it go.
Wow. Wow. You can see why you would need some retraining on that because, like you said, delicate communication back and forth. Um, you said something before. Oh, what was it? Shoot, I lost my train of thought.
There's 100 other things I could talk about. Don't worry, Terry. It'll come back to you.
Come back.
Yeah.
It'll come back. But okay, so just with aging, I guess maybe we could talk about women and men again. Maybe what are, because you know how you said like you had to really reconnect with people or kind of just reorient them on some of these things. But what are some of the signs and signals as you age that might be the first indication that, you might have a concern here? You might need to see a pelvic core therapist or just pay more attention to your pelvic core.
Yeah. So, what I tell people to look out for is the 4 P's: peeing, pain, poop, and pressure. Those are like the 4 big symptoms that I tell people to look out for. Peeing, of course, is if you have any kind of leaking, any kind of dribbling, any kind of urgency, frequency. That's a sign that your body's telling you you've got to pay attention to the pelvic floor. With pooping, it's of course constipation. Constipation is so your bowel movements need to have routine and regularity. I always tell people I like to live my life like a bowel movement with routine and regularity. Um, you know, Consistently straining with constipation can really have detrimental effects to your pelvic floor. So if you have constipation, if you have incomplete evacuation, meaning you evacuate a little bit, but then 5 minutes later you feel like you got to go again, and it sort of goes like that throughout the day. Inability to hold back wind, diarrhea, fecal incontinence, even fecal smearing. You go to the bathroom and you have to keep wiping and wiping and wiping. That could be a pelvic floor dysfunction. It could even be a sign of constipation.
Oh, yeah.
So that is a sign that you need to pay attention to your pelvic floor. Pain is not normal. If you have pelvic pain, groin pain, hip pain, low back pain, bra line pain, rib pain, pain with sex, that is not normal, and that could all be related to your pelvic floor. And then pressure. Very often, pressure is a sign of tension. It could also be a sign of pelvic organ prolapse when your pelvic organs have descended from their anatomical position. So
Ooh, that's the stuff that scares the heck out of me.
it scares the heck out of everybody, but I think the most important thing is if you feel something, say something, because there is so much that we can do to help people with any of those check engine lights.
That was something that I really saw on your website and I really appreciated was, I think it was about bladder leaking, but I just kind of hear, I'm not paying too much attention, but sometimes I'll hear those headlines of those horrible lawsuits from like the mesh surgery and things. And I just think, oh, how horrific. Like, how do people get in the situation where they need this? I mean, without getting too technical, maybe it's down a whole rabbit hole, but like, I think that that's something is totally preventable when things start to drop or things start to loosen, right? Like this is the kind of work you need to know about so that you don't get in a situation where you think you need that. And then heaven forbid it goes wrong.
Right. So, one thing I do like to say is thank God for conventional medicine when it's absolutely an emergency and it's imperative. But what I find is that there are so many people who get to that point because they don't know. There's a lack of awareness, or even more importantly, they don't advocate for themselves. In conventional medicine, my husband's a doctor, my father's a doctor, I come from a family of doctors. They do what they're trained to do, and that's to recommend surgery or recommend medications. They are not trained in holistic, proactive, preventative care. Um,
Amen.
so, what I tell people is you have to be your own best advocate. I'm getting more and more people who are saying, you know what, I went to the doctor, they told me they need surgery. I really want to avoid it. um, can you help me? And I mean, countless times, there's a blog on my website. I hope it's still there. It's called The Day My Ball Dropped. It was a patient who had her third baby. Her doctor told her she had a bladder prolapse and needed a surgery ASAP. I saw her 6 times and she was back to, doing HIIT workouts. So,
Amazing.
she was a nurse. She knew to be proactive. But, do your due diligence, be your own best advocate, talk to people, seek holistic advice. If you think that there's something else that could be done, pursue that.
Yes. Yeah. Last resort. And like you said, I like to point that out too, that, it's the system that's really messed up. It's not the individual doctors that, I've been accused in my past with like, oh, you don't like doctors. It's like, that's not what I'm saying. I'm
Right.
just saying that, they don't have all the answers. And you, again, like you're saying my exact line there about being your own advocate is that's so important. It's so hard to do sometimes, especially when you're first starting out, but more and more there's people like you, there's people like me, people that want to help and kind of guide you or at least offer you information and maybe some better, more informed decisions that you can make.
Absolutely. I think we have to just keep in mind that the current conventional model, which is not getting any better to say the least, and I will not go any further than that because this is not the forum, but it is very reactive. We want to think about being more proactive. When you go to the doctor for any kind of condition, particularly pelvic health, they are going to give you a solution that will most likely put a band aid on it, right? A medication, a surgery. We're not really getting root cause solutions or proactive or full body solutions. And I think that we really need to shift our mindset and be our own best advocates, because if we are a little proactive and we put a little bit of thought and education and knowledge, there is so much that we can do preventatively to optimize our health and really the quality of our lives.
That's it right there. Quality of life. It's all about that. So there was another thing too. I was going to ask you on the physical therapy side of things. When you get to be a certain age, you start to have
Right
aches and
there. Yeah.
right? Aches and pains. And I know in talking to just some of my girlfriends in our 40s now, even if we're not standing on our feet all day, our feet start to ache.
Mhm.
What is up with this foot aching? And probably, I'm imagining it's connected to a lot of other things.
So, yes, that's a great question. I actually be on the lookout because my next three YouTube videos are exactly about that. Are my aches and pains caused by perimenopause and menopause? And the answer is it absolutely can be. When we think about that hormonal shift, we're not only talking about vaginal health, our joints lose lubrication, our muscles, our tendons lose elasticity and flexibility. So that decline in estrogen can absolutely affect our joints, our muscles. And what we see as physical therapists is women who are going through perimenopause and menopause that aren't really being proactive, that are not optimizing their health and their hormone balance, typically, and I should say commonly, will get foot aches and pains, shoulder tendinitis and bursitis, hip tendinitis and bursitis, because just like our vaginal tissues dry out during that season of life if we're not proactive, our joints can dry out a little bit more. We can lose some lubrication in our tendons and our ligaments as well, and in our muscles. So when again we think about perimenopause and menopause health, we've got to be thinking about the whole body. So your aches, joint, muscle aches and pains are definitely going to follow you in that season of life unless you are proactive about it, because I truly believe that you can transition into that season of life and feel better. I'm 51, and I can proudly say that I have no aches and pains. Please God. I have
Love
no
that.
aches and pains. I feel great, and I plan to continue to feel this way. But I am extremely diligent and proactive about my health.
Yeah. Yeah. And of course, I think about food, being that nutrition was a big part of my background, and food first and all that. And then there's some things that you can do, just like you said, with your nervous system that's so important, and
Yes.
self-care type of things, and sleep is so paramount. And
Sleep is imperative. I mean, I feel like that is when we repair, that is when we rebuild, that is when we replenish. So again, in looking at holistic care, that is always one of the most important things that we look at and consider in someone's health and healing.
yes, yes, so many things. Are there any, do you have any top tips? I mean, of course, there's so much that you could say. There's so many things in this whole realm, but do you have like a top 5 that you could share?
Pelvic health or in general?
Let's go pelvic health.
Okay, so I would say pelvic health, but in general, I would say hydrate. Definitely hydrate. I feel like your bladder needs to be hydrated, your stools need to be hydrated, every cell in your body needs to be hydrated. I would say it is the simplest thing that you can do to to optimize your bowel and bladder health. The
True.
other,
Yeah.
yeah, so I would say that. The second thing I would say is breathe. Breathe. I feel like you can affect any system in your body with your breath. Your pelvic floor works synergistically with your respiratory diaphragm.
Mm,
So you can strengthen your pelvic floor, relax your pelvic floor just through the breath. Okay.
love that.
Then I would say avoid constipation. Absolutely avoid constipation, because again, that constant pushing and straining can be detrimental to your health down the line. Um, my top 5, I would say sleep. That's always in the top 5. And I would say most importantly that 2 more things, but they'll go together, that pain is not normal. And just because something is common does not mean it's normal. So if you feel something, if you have pain with intercourse, pain with the bowel movement, if you have leaking or constipation, that is not normal. And there is help for that. So be proactive about it and nip it in the bud when you feel it. Don't let yourself develop layers.
Yeah, that's so important because lots of times people are so busy with their life and they just keep going, 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 and then it's getting worse. And yeah, so it's like what was your line? If you feel something, say something.
Yeah. And if you don't take care of it now, you're going to pay for it later. So it's either a time investment now when you nip it in the bud, but chances are if you don't take care of it now, it's going to be a greater time investment later down the line and a greater monetary investment. So take care of it as soon as you feel something.
So, so important to know and hear again and again. Cause I think even as proactive as I try to be, it's like, oh, that will go away if I just ignore it for a while. But no, it's not the
Right.
way to think.
That's
Yeah.
right.
Is there anything that you are currently working on? Something that's new, a new program, anything that's top of mind?
Yeah, so we actually recently, about a year and a half ago, expanded our practice to include wellness because what I was finding was that we were getting so far with our biopsychosocial approach and our pelvic health strategies were stellar. But we started really recognizing that in order to have long term pelvic health, you needed good gut health and you needed good sleep and you needed a good paradigm to live the rest of your life. So we've extended our offerings to full wellness programs, which is super, super exciting. We do diagnostic testing, we do blood, urine, stool, saliva. We have a brilliant diagnostician. We have a complete online curriculum that help people learn and navigate and to begin to develop a practice for the rest of their lives. And cutting edge information is that we also have just onboarded two brilliant massage therapists that will be working with us in conjunction with our plan of care to help enhance people's healing. So we're really, really trying to make people understand that this is a way to live your life. We want to help people learn to live their lives most optimally, moving on forever.
Yes. And for that quality of life, which is
Yeah,
so important. Oh,
yeah.
so good. Um, Well, gosh, I think I need more coffee. Speaking of which, what do you think about coffee? Because as we're talking today, I keep thinking that, I've gone through the coffee's good for you, coffee's not good for you. Something else might be better. If you're feeling keyed up, then maybe don't have that second cup of coffee. But what do you have to say about coffee? Just curious.
Yeah, I love that question. And I might not give you the answer that you think I'm going to give you, but I'm going to say, what I tell everybody, we have to figure out if coffee is good for you. So, coffee can absolutely act as a bladder irritant. It can act as a digestive irritant. But is it doing that for you? So only about 10% of the population's bladder is affected by coffee. So, what we typically tell people do is to eliminate it and then add it back, eliminate it for 2 weeks and then add it back in to see if it's an irritant for you. I personally go to sleep at night dreaming about the coffee I'm going to have in the morning.
Yes,
So do not ask me to give up my coffee, but what I will tell you is that I delay my coffee for about 45 minutes when I wake up. So my body has a chance to acclimate and really maintain my proper circadian rhythm. I go outside, I get a couple minutes of direct sunlight. Then I have my coffee, but I always have a glass of water before my coffee and after my coffee.
that's a
So,
great point.
yes, to dilute the irritation. So I think it's so important not to make blanket statements. You know,
Yeah, it's
coffee
true.
is bad for everybody. No, we got to figure out how it's showing up in your body.
I love that. I often say nutrition is bio individual
Absolutely.
because I feel like that's the best takeaway I got from my nutrition studies was that, just because I'm going to have a banana today doesn't mean maybe a diabetic should have a banana or whatever,
Yeah. I
So,
think everything we do for people, whether it's nutrition or pelvic health or gut health or nervous system health, has to be bio individualized.
yeah. Great point. And now, just because I just thought of it and it's been on my mind a lot lately, what do you think about the trends that are big right now as far as this hot and cold therapy? Doing the sauna, doing the cold plunge. I've wanted to do it. I've done a little bit of it, but I keep going. How do I know if that's really the best thing for me right now?
So again, I'm going to say that different things work for different people. I will tell you, first of all, I'm not a cold person. You would not be able to pay me $1 million to get into a cold plunge. That's all I have to say. Sauna, different story. But I've had clients who have wound up nervous systems who have really, really transformed their nervous system resilience using cold plunges. So I think they could all be good, Carrie, but I think we have to understand why we're using it, what's our goal in using it, and then is that helping us achieve our goal? So again, it's a modality, it's a tool. It's never the be all and the end all. Healing is also always multifactorial and multimodal. Both of those things could be great modalities if they work for you.
Yeah.
I have had clients who have done cold plunges that it's exacerbated them. So we don't do it anymore. But I've had a lot of clients who have used cold cryotherapy for nervous system resilience that it's worked wonders for.
So good. Yeah, because I think we have to be careful of the trends. And you can see why, everyone on the internet's making it look really cool and really sexy to
Yeah.
want to do the cold plunge, but it doesn't mean it's right for you. And you better be careful just by following every other
Yeah,
trend.
but before you do anything, understand why you're doing it. What are you trying to accomplish? Because it could look sexy on Instagram, but it might not show up as sexy for you.
That's right. That's right. So well
Or
put.
it may. It may. Who
Yeah,
knows?
it may or may not. We just don't know until we look at you.
Yeah, I feel like you got to be thoughtful and mindful about what we're doing with our bodies
Yeah,
and
absolutely.
intentional.
Intentional. Very good. Yeah. So, obviously you have so much to offer in a lot of different realms around health and wellness. Where can people find you if they want to learn more?
So we are pretty much everywhere. We're at LinkedIn, we're on Instagram and Facebook at Pelvicore Rehab and Wellness. I have a podcast called Your Pelvic Health. We have a pretty robust YouTube channel called Pelvicore Plus. Our website is pelvicorerehab.com. And if anybody has any questions, please reach out to me on YouTube, on email, pelvicorerehab@gmail.com. I'm passionate about educating people and really giving them that foundational information that they need that can really change their lives. So we're out there. It
I
won't
love it.
take long to find us.
I love it. Well, I'm going to definitely keep my eyes and ears peeled about those feet videos on YouTube that you
Thank
have
you,
coming
Karen.
out. Can't wait to learn more from you, Susan. And thank you so much for being here and being my guest today. I really, really appreciate it.
This was fun. Thank you, Carrie.
And to close, I will just say to everyone else who's listening, stay healthy so you can stay happy. And I'll see you on the next one.